Natural Medicine, Regenerative, and Pain Center is committed to holistic healthcare approach. With specialty knowledge and application in functional neurology, chiropractic, and regenerative medicine, they use a variety of therapeutic techniques to develop a personalized and unique treatment for each patient. Joining us now is Dr. Alan James, and he is here to tell us about peripheral neuropathy. We've been talking a little bit about it in the break. There's very interesting stuff.
Well, what most people don't realize with peripheral neuropathy, and it's unfortunately because they're told this, that there is help for it. When they're diagnosed with it, they've been told by several physicians that there is no help. You've got to learn to live with this. And it's because they're attacking it where they're trying to treat the symptoms, and they're not actually trying to treat the problem. When you're treating the symptomatology, you use medication such as Lyrica and Neurontin, and that's to kind of dull down the message that the body's sending. Well, the problem with that is you're doing nothing to heal those nerves. And so with peripheral neuropathy, you're losing the sensation. And so you're actually getting a loss of the ability to interpret information such as where your feet are, such as where your hands are. Some of the main symptoms are burning, tingling, numbness, loss of balance, even loss of bowel and bladder control, because as that nerve begins to die, then the body cannot get the message to the brain doesn't interpret it, so it does not get the message back to the rest of the body to tell it what to do. So what we do at JNT is we use several different technologies that are allowing us to regenerate the nerve endings. Now it's on your screen there. As we regenerate these nerve endings, it gets the body to begin to heal. Now there's a very simple test that we also do with some of the technology that tells us if that is too far gone, because it can happen to where the nerve fibers are so far gone that even we can't help. And at that point, I shake hands with them and I say, you know, unfortunately, you're one of the few that we can't help. You're in that 15%. But the other 85% that we can help, we really need to get this message out, because one of the primary or leading causes of death in seniors is falls. And that's because they don't know where their feet are. There's tingling, there's burning, there's numbness. I don't know where my feet are. I'm stumbling through the house. Next thing you know, they fall. Now, this is where I got passionate about working with peripheral neuropathy, because you can save people's lives. My mom's 83 years old, and she has had a fall. Fortunately, all she did was break her elbow, and that sounds kind of silly for me to say, but
could be much worse.
Could have been much worse. And so I've got a passion to take care of my own mom, and there's people out there that don't know this message. And so if I can do something to help those people, and I can, to not fall, then possibly I can save that person's life. And so if you suffer with peripheral neuropathy, or if you have a loved one that is suffering, please get into the clinic, because there's a way that we can test them. It takes about 2 minutes. And in that 2 minutes, we can determine if we're going to be able to help you or not. And if we can help you, it's a big hug and a kiss on the cheek. Hey, I got some good news for you, because we're going to be able to take care of you. We're going to be able to help you actually address the problem as opposed to just treating the symptoms of what you have.
And you have very specific treatment options that you offer.
We have very specific treatment options. One of the primary causes for peripheral neuropathy is spinal stenosis, either in the lumbar spine or the cervical spine. And so we have a device that actually will help to take that compression off of that area and open that area back up to get the pressure off of those nerves. Now, the second thing that we do is we have a device called the HOCAmed, and I think we may have a website for them.
There it is.
Well, look at there. That worked out perfectly.
TV magic.
TV magic. This is awesome. But it's a website that they can go check out. HOCAmed is a German technology that actually regenerates the nerve endings, and that's what we've got to start with. We got to get those nerve endings to heal. And we have another device that's called a PEMF. It's pulsed electromagnetic frequency, very new technology, and look at there, TV magic again. This is awesome.
Isn't it?
What this allows the body to do is have energy to heal, because what happens over time is we lose the energy of our body as we're aging, and the body begins to be toxic. And so what we need to do is detoxify the cells, which is what the PMF will do, and also then re-energize the cells. And the best example I can give you is everybody has a cell phone, right? And what happens every night when you get ready to go to bed?
Gotta plug it in.
Got to plug that cell phone back in. Well, same thing happens to the human body. As we age, we begin to lose the energy. And now we've got to figure out ways to get it back in. Now, obviously, diet, drinking water, exercise, all those things are very helpful. However, they're not enough as we're aging.
Sometimes you need a little help.
Sometimes you need a little extra help. And so that's what we specialize in our office. And so we can do an examination, number one, to determine if you're a candidate to receive this, because you may not be, unfortunately. Number two, if you are, then we'll take you through a full neurological workup that will tell you exactly how much help you can expect and how rapidly you can expect it. Because one of the things that happens in peripheral neuropathy is in the different nerve fibers, you have what are called small diameter afferent nerves and large diameter afferent nerves. And when I explain it to my patients, I explain them to, it's like a big house and a little house. So if you were going to build these two houses and you started at the exact same time, which one would get built first?
The little one.
Well, of course, the little one. And that's the same way as we're rebuilding the nerves. As you begin to get those nerves to heal, you're going to go through, because the small diameter afferents carry pain. And so you're going to go through this period of time where, hey, this is beginning to actually hurt again, doc. I don't know if we're doing the right thing or not. And I always tell them this is going to last about 2 or 3 weeks because we're bringing those nerves back online because as we talked about when we first started, as you begin to lose that ability to interpret the information, we got to get the brain back online.
Right.
So we got to bring those nerves back online by reconnecting them with the brain and then stimulating that part of the brain so it can then interpret the information. So for that 2 or 3 weeks, you're going to have that burning like, hey, it's getting a little bit worse. I'm not sure this is doing, okay, you know what I'm talking about because you've had an injury.
Had an injury, felt like fireworks going off underneath my skin. That was the worst part of my recovery.
And how long did that last?
I don't remember, thankfully.
I bet you about 2 or 3 weeks.
It was about 2 or 3 weeks, yeah.
Because then the large diameter afferents, which is the big house, it gets built. And as the big house gets built, now they're starting to kick in. As they kick in, they will actually begin to quiet down the other nerve fibers, so that you're not going to feel the pain nearly as much because now these other ones are inhibiting that.
Well, where can we find more information about your, I think we have some on the screen right here.
It's
more
TV magic again.
All right, well, you have all the information here for J&T Natural Medicine. Thank you so much for being with us here today. Learned so much. Again, the power of TV magic, but also
that was fun.
your natural medicine magic as well.
Exactly correct.
All right, well, thank you so much. Again, coming up, we have more high-tech gift ideas for grads and dads. You don't want to miss out. It's coming up next.